We know reproductive rights are a top issue in President Biden's re-election plans, and we fully expect him to address this in his State of the Union address tonight. We saw how important it was for voters during the midterm elections.
And how Americans in red and purple states have even voted abortion rights into state constitutions with those measures. It's an issue across the country that we've seen since the fall of Roe versus Wade. We also know there's concern that access to birth control could be in jeopardy at some point, mifepristone. And we saw the scramble in Alabama to protect IVF treatments after the state Supreme Court ruled frozen embryos are people.
Joining us now is OBGYN Dr. Greg Marchand on the divisive issue of reproductive rights. We actually saw rare bipartisan support in Alabama over protecting IVF treatment. So what do you make of the state Supreme Court ruling, first of all, and then this new legislation?
Well, I think the ruling was misunderstood largely by the public and the media. What the ruling was really saying, in this unusual circumstance where an IVF lab had their freezer left unguarded, a patient was able to come in there and accidentally destroy some embryos. What the initial ruling was saying was that Alabama values the sanctity of life very, very highly, and that if somebody accidentally, through their own negligence or intentionally destroys an embryo, that's going to be treated very seriously in Alabama. It's not going to be like destroying property, at least from a civil liability and financial standpoint. It's going to be treated like ending a human life. So this was really taken out of proportion quite a bit. I heard a lot of crazy things in the media, like saying that mothers would be forced to have embryos implanted even if they were genetically abnormal, or that people would get charged for murder for discarding their embryos. And really none. It just was showing that Alabama values the human life in a very, very high way. And as a result of this law, there are going to be extreme civil penalties for anybody who intentionally destroys someone else's embryos.
Okay, but just to push back a little bit, in the wake of this ruling, IVF clinics all across the state decided this is too risky for us. So there were, real life consequences to it. You think that was an overreaction?
If you look what happened, no, I don't think it's an overreaction. If you look what happened, an IVF clinic left their freezer full of human embryos completely unguarded. There was no lock on the door. There was no lock on the freezer. Somebody literally just walked in and destroyed the embryos. So I do think it's a good time for all IVF clinics to take a break and make sure policies are in place to make sure your embryos, that human life is protected. And of course, anytime there's a change in any law, it makes sense to stop your protocols for a minute and make sure you're in full compliance. But if anyone thinks that this law could be used to prosecute an IVF doctor or to prosecute someone who's undergoing IVF for discarding their embryos, I think no one was ever intending that to be the outcome. This ruling was made in order to punish people who either maliciously or through negligence destroy somebody else's embryo.
I mean, you're bringing up the point that the families who sued from the jump here over this, this was their one shot at building the family that they wanted, and of course that is why they sued to begin with. I think the question that I'm curious about, given what you're saying, is the overall context of how we have seen, and because you are an OBGYN yourself, the context is that when it comes to abortion, separate issue, how state by state having this patchwork of rules has made it very, I think the word is maybe convoluted for families who are trying to navigate. So there were others that we had spoken to who had argued that it's less about where could this go and more how it's nebulous, it's unclear, the law. And so even now, there's implications on trying to protect providers like yourself, families included. So my question to you, with that context surrounding it, are you worried that what happened down in Alabama could have implications in other states?
Absolutely not. As I said, I think this is really only applying to civil penalties for when someone destroys someone else's embryo. As you can see by the scramble of lawmakers to go back and pass a new law to be sure IVF doctors were going to be protected. They understood that this could be misunderstood by some people into thinking that they're trying to crack down on women's rights or women's reproductive rights. And I really don't think that's the case in this perspective. Now, you're certainly right that people of Texas, the constituents in Texas have voted and passed laws to make elective abortion illegal. So that certainly is illegal in Texas. You do need to leave Texas if you'd like to have an elective abortion. But I don't believe that's in any way affecting the availability of IVF rights in Texas, at least once these laws are passed and the reaction to this completely plays itself out.
Are you planning to watch the State of the Union address tonight? I know this is what we're talking about here. And if so, what are you expecting to hear from President Biden when it comes to reproductive rights?
Well, reproductive rights and abortion in general have been a very, very hot topic for one particular party. The problem with addressing this politically is that this area has much more misinformation that's much more dangerous than other areas of misinformation. For example, if you wanted to slander somebody or say somebody did something bad or was a racist, you could have somebody else who is fact-checking you, maybe Google it. But when we're talking about things about abortion rights, and reproductive rights, it becomes a lot more difficult, and you need some medical knowledge in order to understand a lot of things that are being said really might not be true, and the common person or the common person behind a Google search browser might not be able to find that right away. So I'm really worrisome of misinformation from Biden about abortion in states that have decided to ban elective abortion or put restrictions on it. And you are completely right. That had a very huge effect in the last election cycle, especially on the younger college-age population.
OBGYN Dr. Greg Marchand, thank you so much for your time today. Appreciate it.